Good morning, Arc Electric. This week's topic is working in the cold. General duty, it's an OSHA required training under General Duty 1910.132. And beside there's a request about dealing with the cold as well. So that is our topic for OSHA compliance this week. Hopefully it'll teach employees to recognize the hazards and symptoms of the exposure to cold, know how to prevent and respond to cold exposures. Overexposure, frostbite. Body tissues may freeze when the skin is exposed to extreme cold or touches very cold object. The nose, ears, cheeks, fingers, and toes are at the greatest risk. Worst cases can cause permanent tissue damage, loss of movement in the affected parts, and possibly unconscious, or even death from a heart failure. Damage may be greater if the body part, is thawed, then refrozen. Hypothermia. Exposure to cold may send body temperatures to dangerous low levels. It can occur in above freezing temperatures when it's windy and you've exhausted or wearing wet clothes. Worst cases can lead to unconsciousness or even death. Factors that increase the risk of frostbite or hypothermia include the following: age, overweight, smoking and drinking, certain medications, allergies, and or poor circulation. Victims' failure to recognize symptoms and take the prompt action. 2, reduce the risk and exposure to extreme cold. Avoid breathing, smoking, or drinking alcohol before going into cold conditions. Wear layers of loose, dry clothing. If possible, wear wool underneath and waterproof layer on top. Always cover the hands, feet, face, and head in the cold. An uncovered head can make the body lose up to 40% of its heat. Change or get dry immediately if clothes get wet. Keep moving while working the cold. Take regular breaks in warm areas. Move to warm area when you start to feel very cold and numb. Have a warm, alcohol-free, caffeine-free drink. Recognize frostbite and hypothermia symptoms. Include the following: feeling extremely cold and numb, with possible tingling, aching, or brief pain, white or grayish yellow glossy skin, which may blister. Confusion, failing eyesight, shock condition as the condition progresses. Hypothermia conditions and symptoms are as follows: chills, shivering, numbness, sometimes pain in the extremities, slurred speech, poor coordination, confusion, drowsiness. Respond quickly and correctly to a frostbite or hypothermia symptoms. Act immediately when symptoms develop to prevent serious problems. Move to a warm place. Replace frozen wet or tight clothes with warm clothes or blankets. Drink warm beverage without alcohol or caffeine. Get medical help if it's necessary, and first aid treatment. Take first aid actions for frostbite. Warm the frozen part immediately with blankets and warm, not hot water. Avoid touching the frozen part. Don't rub or hit it. Keep the frozen part away from hot stoves, heat lamps, or hot water bottles. Don't break blisters or drink anything with caffeine. Exercise the body part once it's warm, but don't walk on frost-bitten feet. Take first aid actions for hypothermia. Cover the person with blankets and lie next to a person to give body heat. Don't use hot baths, electric blankets, or hot water bottles. Keep the person awake and give artificial respiration if it's needed. Get emergency help immediately if the person loses consciousness. And then there are some discussion points. In conclusion, when it's cold, be constantly alert of health hazards. Dress and move to prevent frostbite and hypothermia. Act immediately if you or someone around you experiences symptoms. And there will be a test that will be sent to Troy to pass along to each one of you. That's the message for the week. Make safe, healthy, and whatever you do, always remember, have enough layers of clothing to cover all those open skin areas. Have a great week.